Okay, can you guys hear me now? Hello, hello. Okay, can you guys hear me now? Fixing the stuff. Hello. Okay, can you guys hear me now? Hello, hello. Okay, is it better now? Yes? Okay, sounds good. Well, welcome. Good morning. How are you guys? It's so nice to see you guys, all you wonderful people out there. It's a beautiful, beautiful Saturday morning, and thank you for coming in. I know you guys all had to do lots of work, getting all the parathas ready in the morning, khandvi ready, or whatever you guys eat, So thank you for coming in. I'm pretty sure you fed your families the breakfast and you guys are here for the learning session. Okay, beautiful, beautiful. It's echoing. Okay, Harpreet, try using the headset because I have stopped everything from here. Is it echoing only for Harpreet or is it echoing for everybody? If you guys can please let me know before we start. Says it's echoing. Yeah, Mandeep. Good morning, guys. Guys, is it too much of echo? Let me know. Is it better? Is it lots of echo or yes? Sabita, Rajwinder, if you guys can please let me know. Hi, Harpreet, Shilpa, Shagun, Mandeep. It's fine now? Okay, perfect. Yeah, because my voice tone is also like super kind of in a louder way. So, okay, good morning, guys. Shilpa, is this okay? Yes? Okay, perfect. Give me a quick second, guys. I'm also going to forward a link to our students here. I'm pretty sure they are kind of waiting for our live as well. Because everybody wants to, why not to revise ECG? It's a great, great, great topic to study. Give me a quick second here. I'm gonna give this. Okay, I'm gonna give this to my team. They're going to forward it on all the groups here. So team, if you can please forward this link to all the other groups for that. Yes, Sabita, good to see you guys too. Shilpa, good to see you guys. Okay, now 73 people are in here. I'm very excited. This gives me lots of motivation. I was thinking like probably 10, 15 people. It's all your love that you guys are here. Good morning. And before we start the class, I just want to say thank you for coming and let's just learn something. Tell me, have you guys got all your pen and paper ready? Because for ECG analysis, that's what we need. You have to have a little pen and paper because I'm going to give you guys like small little guru mantras here and there. And make sure you guys keep chatting with me. It's not like a class where you guys can talk to me and I can know, but keep chatting with me. That gives me motivation and that keeps me telling what's happening with the students here. Okay, so before I start, I always love to know what my student score is. Like, as nurses, we always do assessment. We always do pain assessment. You ask the patient, 0 means no pain, and 10 is full on excruciating pain, 10 on 10 pain. So tell me what your pain score is, right? So now I want to know your score and be very honest, think about it. What's your ECG score? Like, is it completely 0? You don't have to tell me. Just write it in your notebooks, or even if you feel comfortable sharing it in a chat box, then do it. If you're not comfortable, just write it in your notebook. Is your ECG, what do you think? Is your ECG level is 0? Is your ECG level is 50-50? Or your ECG level is like 10 on 10? You say, I am superstar. What do you guys think? Good morning, everybody. So tell me your scores a little bit. Yes, heart to you as well. So a little bit. 3. Harpreet says her score is 3. Good job, Harpreet. Thank you, guys. Keep popping up messages a little bit faster. Lovepreet, 5. Amazing. Because what we are going to do is we are going to do pre and post analysis. We'll see how you feel before class and how you feel after class, right? So Amandeep, 2. Good job. And I also want to say, when we deliver our classes, guys, there is no judgment in our class, okay? I am here to teach you guys, to help you guys. And like, we are not going to judge, hey, you don't know this or you don't know that, right? So yes. Hello, Rajwinder. Hello, all you beautiful people. Sabita is 50 on 50 because I know Sabita, you were my student, right? If I'm not wrong. Or you're just saying 50-50. Okay, totally get it. Shagun is 50-50. Rajwinder Bal, I know you are my student. Rajwinder is saying she's on 9. Okay, perfect. Navjot, 5. Vishwa Patel, 5. Okay, that's what your score is. Cool. So should we start now? And be very focused. And it's going to be like fun. Give me a quick second. I'm just going to turn the fan off. I don't want any, sounds going on, bugging on here and there. Okay, perfect. I hope now there is like no noise at all. Yes, 130 people are online. So hi, Gurpreet. Gurpreet, thank you so much. Love you, Gurpreet from Regina. The video we can watch later on YouTube. Yes, you guys can. Your way of talking start boosting our energy. Oh my gosh, I love you guys all, right? It's beautiful. Guys, the reason why we are here, as I said, I want to say education is important for everybody, right? And this is what our team decided, that we want to help everyone. We want the international educated nurses, when they go on floor, we want you to be successful, right? So that's very, very important. And the reason I will tell you why internationally educated nurses, they are hesitant to work on acute areas, because they are scared. And please keep participating. You guys can put your under the comments. They are scared. Right. Okay, perfect. Good question. Okay, and another question, that's a very good question my team has reminded me, is how many of, hi Mandeep, how are you, beautiful girl? I know Mandeep is my student too. Mandeep is working as educator now. Mandeep, see, that's how I know my students. Mandeep, I hope you're enjoying your job as educator. Good job. And guys, so before I start, it's always good to know what language do you guys comfortably speak. I will definitely deliver this lecture in English, because we have students not just from India, we have students from Uganda, Ghana, Cameroon, South Africa, Pakistan, Nepal, United States, Australia, you name it, right? So we have, like, sorry if I miss your country, Sri Lanka, everywhere. And so I would love to know, what language. क्योंकि कभी कभी कोई जोक भी तो होना चाहिए ना क्लास में. अब क्लास बोरिंग ही होगी तो कैसे अच्छी लगेगी? आपको अच्छी लगेगी, राइट? सो टेल मी, कैसे बोरिंग पढ़ाऊं, लाइन बाय लाइन पढ़ के कि इंटरेस्टिंग तरीके में पढ़ना आप लोगों ने, राइट? सो दिस इज व्हाट वी आर गोइंग टू डू. Thank you, Mandeep. I'm very happy you're working as educator now. Okay. Yes, Pooja, it feels like you're attending my class. Hey, same thing. Yeah, this is what we want to tell people. Those who are, sometimes people are hesitant to contact FBNPC. So coming back to this point, why we are here. We are here to spread love, positivity for everybody. And we just want to say this message to all the internationally educated nurses who are listening to us now live, or those who will be listening to us after, that nursing is beautiful and you will always succeed and enjoy in this profession. As long as you know what you're doing, as long as you know your skills, you are going to be a rock star in the clinical area. You don't have to worry about people bullying you. You don't have to worry about anything else, as long as you are confident in the job, what you do. And that's why we are here. We are here to support nurses, because now what we are hearing the most is people are saying we are not getting jobs. So I will share with you guys the reason why people are not getting jobs is, number one thing is they're not confident in themselves. And that's a reality, because we do interview hundreds and hundreds of students, guys. And this is the message which is coming up, like they're not confident. They're not confident because they don't know, how the things work here in Canada, America, or Australia. Were they excellent nurses back home? Yes, they were. Beautiful, fantastic, excellent nurses. But guys, scope is very different, right? I give a very simple example in my classroom. Let's just think about, I'm just going to give a very, and tell me, you guys can tell me in the chat if that is true or not. In India, this is a very simple example. Patient is the only one who doesn't know that patient has a cancer, and the whole family knows it. Isn't it? Because everybody wants to hide it. Why? Because that is our culture in India back home. In Canada, it's totally different. It's patient who needs to know everything. And then you don't go and disclose it to the family members until and unless patient consents to do that. So अब देखो कितनी छोटी सी बात है, right? कि आप वहां पे हम लोग families को बताते हैं सब कुछ, यहाँ पे हम लोग सब कुछ patient को बताते हैं. एंड देखो इतने छोटे से डिफरेंस से ही आपके कितने सारे क्वेश्चंस गलत हो जाएंगे एग्जाम में. Does that make sense? So अगर आपको, चलो ये तो रही एग्जाम की बात, पर आप असली जिंदगी में भी सोचो, एज अ नर्स व्हेन यू आर गोइंग टू वर्क ऑन द फ्लोर, अगर आपको ये छोटे छोटे एलिमेंट्स नहीं पता तो क्या होगा? यू विल नॉट बिकम अ सक्सेसफुल नर्स देयर, राइट? और इन्हीं चीजों से लोगों को डर लगता है, राइट? एंड दिस इज व्हाट आई एम very confident to say our students, they know all those things. That's why they go and they crack the interview. Mandeep, as I said, is already here with us, and she's working as educator. और भी मेरे बहुत सारे लोग हैं, मेरे students, lovely. I think FBNPC platform is so huge that our nurses are now everywhere, from East Coast to West Coast. United States में भी हैं, Australia में भी हैं. FBNPC nurses are everywhere now. So we are really proud of you guys. So I want to give this hot to all my students out there. Okay guys, so English and Hindi. हाँ जी, पंजाबी जोक भी चलेगा, मार दियो विच जोक.
You want to ask people what language they want this lecture in?
Okay guys, so which language do you guys want this lecture in? English. So I'm gonna deliver it in English, but then Hindi and Punjabi will work in between. Put it in a chat box. Oh my gosh, guys, there's so much of love. I didn't expect it. 183 people online because, you know, Hindi and English, Patel, Charmi Patel. Okay, perfect. Okay, anybody else who is from a different country? Let's just say not just from India, but from anywhere else you guys are watching us. I know in yesterday, our test live, somebody was from Pakistan, and I'm not sure if they are still here or not. Okay, chalega? So English and Hindi, that's what majority of. अच्छा जसमीन कहनी पंजाबी, okay, तो निकी निकी पंजाबी भी बोल देंगे, कोई गल नहीं. I can shift gears. I'm okay with that. Okay, चलिए शुरू करिए. Thumbs up. Okay, perfect. Thank you, Indra. You are such a blessing. Okay, give me a quick second here, and I'm gonna share the screen with you guys, and you guys tell me if you can see it or not. Okay. So this is also, I want to practice because this is my ਹਾਂਜੀ joke in Punjabi. ਆਪਾਂ ਦੇਖ ਤਾਂ ਕਿ ਠੀਕ ਠਾਕ ਹੀ joke ਮਾਰਾਂਗੇ, ਭਜਾ ਨਹੀਂ ਦੇਣੇ ਆਪਾਂ ਨੂੰ, ਹੈ ਨਾ? ਜੇ ਜ਼ਿਆਦਾ jokes ਹੁੰਦੇ class ਚ ਆਓ. Okay, give me a second here. I am going to share, and I want to see if I can share the screen or not. Let me just see. Okay, so can you guys see the screen? Give me a quick second because there is a time lag too, right? So I want to see if I can share it. It does show me. Oh yes, perfect. So guys, keep sending your comments because my team is tracking your comments. Now I'm kind of more focused on teaching you guys. So today, okay, give me a second, guys. I'm just gonna test something, okay? If that's okay. I'm gonna stop share and give me a quick second. I'm gonna put myself on mute. Just give me a quick second here, okay? Okay, guys, I am back. I was just kind of playing with some setting around and see. So let me know if you guys can hear me. and I can share my screen. And I'm just, as I said, this is a first live class, so I'm just trying to figure out, so just bear with me here and there. And because I also want to see your comments. I don't want to miss those comments. Can you guys see my screen? Yes? Okay, so today we are going to review and talk about ECG, right? I hope everybody knows what ECG stands for, guys. ECG stands for electrocardiography, right? And ECG, lots and lots of students, when I work with them, they're like always scared of ECG, right? I don't know why. क्योंकि मैंने लगा वो पुट्ठियां सीधियां लाइनें है ना, वो जो ऊपर नीचे लाइनें जा रही हैं, तो अब वो उससे घबरा जाते हैं, मुझे लगता है सब लोग, right? So घबराने की बात नहीं है. It's all about understanding, how you understand the cardiac system. So before I start the class, I think it's very important for students to understand their teacher. क्योंकि जितना जरूरी टीचर के लिए है अपने स्टूडेंट्स को जानना, उतना ज्यादा आई थिंक स्टूडेंट्स के लिए भी जरूरी है to know who their teacher is, कि वो किससे पढ़ रहे हैं, ताकि उनको एक कॉन्फिडेंस मिले कि कि हाँ हमारा टीचर हमें ये करा सकता है या बता सकता है. So guys, my education, I graduated from PGI Chandigarh in 2008, and I received University Gold Medal. And I topped all 4 years in my Bachelor's of Sciences. And then I did my master's in hospital management, guys, in India in 2010. I also worked in intensive care unit. So those who are from PGI Chandigarh, they would know. I worked in main ICU for 2 years. Primarily, I have worked with neurotrauma patients. That's my specialty is. You name it, every neuro condition, what you see in your books. For example, myasthenia gravis, Guillain-Barré, subdural hematomas, everything I have seen it with my own eyes. I had so much passion and love for education that I wanted to pursue my career, and I wanted to do something more in critical care nursing. So I moved to Canada, and I did my program in Kitchener, Ontario. That's why I say my heart is always in Kitchener. So I did my diploma in clinical and critical care from Conestoga College, and I was awarded with Award of Excellence in 2011. Then my journey started as registered nurse. But between that, guys, मैं आपको छोटी सी story सुनाना चाहती हूँ, if you guys are okay with that. Sometimes students, they feel like कि Taran, आपको हमारा दर्द कैसे पता है ना? Guys, क्योंकि I came also as international student. This is what I want to share with you guys. And मुझे पता है कि international student की journey जो है ना, वो आसान नहीं है. Like it's a very tough journey, right? तो वहाँ पे आपको पता है, कि there is like nobody supporting you, आप अपनी family को miss कर रहे हो, there is, emotional setbacks, you have to, do everything, आपको रोटी तक खुद बनानी पड़ती है, कैसे वो अपने $200-300 में गुजारा करना है. I have gone through every single phase of it, and that's how you would see FBNPC connects with the students at the ground level. Because both myself and the founder, Harry Sagar sir, he also pertained his journey as an international student. So we know how challenging it is, right? As an international student, you move on up, you are going through the journey and you want to do something in your life, right? So that's how we are setting an example that you guys can do it. If we have done it, you guys can do it too. This is the message which we want to deliver. I remember I walked kilometers and kilometers in snowstorm, because it was hard to afford taxi is like super expensive. So we have all gone through those phases. So that's why we are here to support you guys, that you guys can do it too. And believe me, the one profession which has changed our life is nursing, right? So this is what I want to say and convey this message to you guys. Okay, now let's just moving back and sharing my screen. Then guys, I worked as registered nurse, and I got very easy permanent residency in Canada with the help of hospital. So Yorkton Regional Health Center Hospital helped me in becoming permanent resident, and I worked there in that acute hospital for 3 years. I worked in all the settings. I worked there, emergency department, PAC clinic, medicine, surgery, pediatrics, endoscopy, you name it. Like I have worked all those areas. Then my passion and love was always for teaching. So मैनू सीगा कि मैं ना पढ़ाना है यार, मैं बस मैनू पढ़ाने दा ना शौक ही है ना, जेडे मेरे स्टूडेंट्स उन्होंने पता है कि like I can talk for hours. This is my love for teaching, and I want people to be educated and become very successful and skillful nurses. So I joined my job as adjunct nursing professor and nursing instructor in RN program. So मैंने RN program में पढ़ाया है यहाँ पे in University of Regina and Saskatchewan Polytechnic for almost 8 years, right? And I am also a certified medical surgical nurse from CNA, which is Canadian Nurses Association, right? So ये एक specialty exam होता है जो आपको लिखना पड़ता है. And I am specialized in medicine, medical surgical nursing. And I have been mentoring internationally educated nurses since 2016. And I can proudly say that we have been very experienced in this industry. Almost 8 साल हो गए हैं, right? हमें into this profession. Okay, so that was about me. So I hope now you guys feel satisfied and you know that you are in good hands. And then I want to move forward and talk to you guys a little bit. So what are we going to do today? For every class, we have set objectives, right? So today, again, I know when you do ECG, just want to tell you guys, जब हम ECG करते हैं ना, guys, ECG is almost in a specialty, it's a 32 hours program, right? So जब मैंने की थी specialty, I had to do study ECG for 32 hours और मेरे पास अभी सिर्फ 30 minutes हैं आपको पढ़ाने के लिए. So I will do my best whatever I can, but it's a big course, you know. And again, this is what we do at FBNPC is we break it down. आपको सब कुछ नहीं चाहिए. Let's just say today I will only focus on NCLEX part, right? So in NCLEX, because now I'll show you, like when we study, there are lots of things which you can make this topic super complicated. But हमें उतना complicated चाहिए नहीं है क्योंकि जो NCLEX exam is for entry-level nurses. Let's just say you graduated today from the college and then you're writing this exam. तो इतना आपको hi-fi fancy चीजें नहीं चाहिए, आपको बहुत simple चीजें चाहिए. And that's what I'm going to cover with you guys in this classroom today. We will talk about anatomy of the heart, electrical functioning, basic rhythms, atrial rhythm, and ventricular rhythm. So this is what is going to be the goal. Okay, so I am going to give you guys now, promise with me. Here is, I want to give a disclaimer before I proceed on. I give you guys some realistic examples, but don't do those actions at home. Okay, so ये मत कहना कि तरन ने कहा था इसलिए हमने कर दिया. So you need to understand that heart has two functionings. Okay, one is mechanical functioning, another is electrical functioning. So mechanical functioning क्या है guys? Mechanical functioning है कि आप देखोगे कि अगर heart है, and you know I'll show you the anatomy. So अगर heart contract कर रहा है, relax कर रहा है, contract कर रहा है, relax कर रहा है, उसको हम कहते हैं mechanical functioning. But उसके पीछे जो है वो है electrical functioning, जहां से वो electric current जो है वो जा रहा है, and then you know mechanical functioning is occurring. So students कहते हैं तरन यार मैं कैसे याद रखूं कि electrical पहले आएगा, mechanical पहले आएगा, बड़ा confusing है. अच्छा simple example देती हूँ मैं आप सबको. करना मत घर में, ओके? सो सोचो कि अगर आप अपना हाथ इलेक्ट्रिकल सॉकेट में डाल लो, ठीक है? मुझे बताओ क्या लगेगा पहले इलेक्ट्रिकल शॉक लगेगा कि नहीं लगेगा? मान गए सारे? तो आपको पहले लगेगा झटका, फिर आपकी बॉडी मूव करेगी. सो रिमेंबर, सो दिस मीन्स व्हाट कम्स फर्स्ट? इलेक्ट्रिकल शॉक कम्स फर्स्ट फॉलोड बाय मैकेनिकल. सो झटका पहले लगेगा, बॉडी मूव करेगी. सो दिस इज हाउ इट इज इन द हार्ट. सो व्हाट्स गोना हैपन? Electric shock will come first, which is conduction system will come first, followed by your mechanical functioning, right? So this is how it occurs. This is a very simple way I teach my students to remember the things. Okay, so yaad rakhoge? If somebody asks you which comes first, mechanical or electrical, you guys can type it in the chat box, right? I'm gonna have a look at it. Okay, so I hope you guys know which one comes first. Mechanical? No, you guys know that it is electrical, right? So electrical first, followed by mechanical. Now, this is heart. अब इसको देख के डर मत जाना. Don't get scared by looking at this because this is all about mechanical functioning. And you know, in today's class, we are not going to work on mechanical functioning. We are only doing electrical functioning. But this is the heart. Just want to quickly walk you guys through. If you look at it, like, you know, heart has 4 chambers. And you guys know we do right atrium, right ventricle, left atrium, and left ventricle. Now, this is general basic anatomy physiology, which everybody should know, right? Nobody should, you know, think about it, ki yaar, mujhe nahi aata. Nahi, as a nurse, you guys have to know. Now, I'll share with you why you need to know. You know, this is how I keep on adding little stories in my class too. When I was working, as I said, when I was studied as a student in Conestoga College, because of my grades, they selected me to go to step down ICU for the practice. So guys, when I was practicing, I have worked with super intelligent nurses. My preceptor was so intelligent. शी कुड पिक अप अ 12 लीड ईसीजी और वो ईसीजी देख के बता सकती थी कि कौन सी आर्टरी, कोरोनरी आर्टरी ब्लॉक्ड है। सो इस तरह की आप इंटेलिजेंट नर्सेस के साथ यहाँ पे कनाडा में या अमेरिका में, ऑस्ट्रेलिया में आप जाके डील करते हो। एंड दैट्स व्हाई हमारे लोग जो है वो घबरा जाते हैं कि यार हमें इस लेवल का नहीं आएगा। वो एक फियर है, एक फोबिया है। पर अगर आपको अच्छा पढ़ाने वाला मेंटर मिलता है, यू गाइस कैन लर्न एनीथिंग। मैं उस टाइम पे मैं स्टूडेंट होकर ये सोचती थी, काश मैं मरी की तरह ना 10% भी बन जाऊं तो मेरी जिंदगी सक्सेसफुल हो जाएगी, राइट? And this is where we are today, and I am so thankful to all my teachers, my preceptors from where I learned. And now it's my job that I'm going to deliver that information to you guys ताकि आप लोग भी अपनी जिंदगी में एक successful nurses बन सको. Okay, so every nurse should know a simple cardiac function. So you guys should know right side. I simply tell my students deal with the deoxygenated blood. Okay, and left side of the body deals with the oxygenated blood. Okay, and every nurse should know that from right ventricle, so blood comes through superior vena cava and inferior vena cava. And where does it go, guys? On the right atrium. Then right atrium will send that blood to right ventricle, and then from right ventricle that blood goes through pulmonary artery to where? To lungs. Sorry, I'm just going to go back here. Okay, and then what is the job of lungs? Because you guys know right side is giving deoxygenated blood to the lungs, and the job of the lungs is to oxygenate that blood. So once that blood is oxygenated, this oxygenated blood is returned to the left atrium, and then from left atrium, guys, through the valve it goes down to left ventricle, and then left ventricle is going to push that blood through to the entire body using the largest artery, which you guys know is aorta. So this is what the simple anatomy and physiology works. And again, the blood is going down from atrium to ventricle, and then ventricle is pushing out either to pulmonary artery or to aorta. This is all mechanical functioning. But are we doing mechanical functioning today? No, we are going to work on electrical functioning, right? And you guys know now, remember that electrical socket example? If you put your hand in first, the shock will come first. So you need to understand that in our heart, there is an impulse generator, right? So impulse generator is where the electric current is generated. So where is that electric current generated from? SA node, and it stands for sinoatrial node. Okay, so that's gonna fire some electrical signals. And when it's firing those electrical signals, that SA node, then those signals are further caught up by AV node. मतलब SA node झटका शुरू करता है, and then that झटका moves down to AV node. फिर AV node से आगे वो जाता है bundle of His, फिर bundle of His से वो आगे जाता है Purkinje fiber. So इस तरह से जैसे जैसे आपकी इलेक्ट्रिकल ट्रांसमिशन हो ही जाएगी, वैसे वैसे आपका हार्ट जो है वो कॉन्ट्रैक्ट करेगा. सो अब आप खुद सोचो, ऐसे नोड से एवी नोड पे जा रहा है, सो मींस आपके एट्रियास कॉन्ट्रैक्ट करेंगे. फिर जब वो एवी नोड से बंडल ऑफ हिस पुरकिंजे फाइबर में जा रहा है, तब आपके वेंट्रिकल्स कॉन्ट्रैक्ट करेंगे. एंड ऑलवेज रिमेंबर, इलेक्ट्रिकल फंक्शनिंग फर्स्ट, फॉलोड बाय द मैकेनिकल फंक्शनिंग. सो इतनी सी बात अभी तक समझ में आई है. अगर मैं बहुत ज्यादा तेज जा रही हूँ, इफ आई एम टू फास्ट, क्योंकि मुझे थोड़ी जल्दी बोलने की आदत है, तो मुझे प्लीज बता दो. I can slow it down for you guys, and I would request my team to bring the comments here so that I can see the comments if they have any comments for me, and if they have any questions, so you guys can put the question in the chat box, okay, and let me know. So team, can you please bring it here? No questions so far? Okay, so thumbs up so far. Aage chale? Yes? Okay. So then this is SA node, and you guys know from SA node, where does the electric current goes? AV node, which stands for atrioventricular node, bundle of His se Purkinje fibers, and this is how the electrical transmission is taking place. Now, let's just talk about ECG. अब ये जो current है, वो कैसे जा रहा है, right? So how that current is flowing into the heart, that study is called as ECG. और ECG आप देखोगे कि why we do this procedure very often, because this is non-invasive, painless procedure है, harmless है. सिंपल है, इतने ज्यादा पैसे नहीं लगते, राइट, एंड यू कैन इजीली डू दैट टेस्टिंग, राइट. सो दैट्स व्हाई डॉक्टर्स वुड रेकमेंड कि इससे पहले जाके हम काटा पीटी करें पेशेंट की, let's just figure it out ke what's happening with a simple ECG, right? And now let me tell you guys a little bit scope of practice here. So in India, I'm talking about from 13 years, अब तो मुझे इंडिया छोड़े 13 साल हो गए, right? So 13 years ago, guys, we were not taught ECG, है ना? So हमेशा मेरा, and I'm here to share my feelings with you guys too. So मुझे हमेशा था कि यार कि कोई हमें ना ECG अच्छे से सिखा पाए. अब क्या था कि जब हम जाते थे, जैसे समटाइम्स वी वर नॉट टॉट इन द नर्सिंग स्कूल्स एट दैट टाइम. अब चेंज हो गया हो तो काफी चेंजेस आ गए हैं. एंड देन अगर आप डॉक्टर्स के पास जाके पढ़ते थे, वो आपको टू मच हाई फाई फैंसी बता देते थे, तो वो इंसान ना स्टक हो जाता था कि यार मुझे कितना समझना चाहिए एज अ नर्स. नाउ हियर इन कैनेडा, specifically I talk about Canada because I've worked here in Canada. So in Canada, guys, मैं आपको बताती हूँ सिंपल. जब मैं जाती थी even as a student, precepted student, तो when you guys work in the specialty units like cardiac units and stuff like that, फर्स्ट जॉब आपकी सुबह सुबह जाते ही नर्सेस का यही काम होता है कि आपने ईसीजी स्ट्रिप प्रिंट करनी है. आप फिर ईसीजी स्ट्रिप को आप कैलकुलेट करते हो, आप पढ़ते हो, आप देखते हो कि आपके पेशेंट को क्या चल रहा है, एंड देन ऑन द बेसिस ऑफ ईसीजी स्ट्रिप्स यू प्रायोरिटाइज योर क्लाइंट्स. ओके, सो इसलिए अगर इफ यू आर एमिंग टू बिकम नर्स, जिसने स्पेशलिटी करनी है, कार्डियक एरियाज में काम करना है, you need to have an extensive knowledge for the ECG. But again, इस क्लास में again I know I have to narrow it down because I'm doing very very basic here. मैं बहुत ज्यादा हाई फाई फैंसी नहीं पढ़ाऊंगी आप लोगों को, सिंपल चीजें बताऊंगी. ओके, सो नाउ आपको सिर्फ इतना पता होना चाहिए बेसिक लेवल पे कि जो साइनो एट्रियल नोड है ना, जहां से झटका, इसको कहते हैं हम इम्पल्स जनरेटर हो रहा है, और इसको हम सिंपल लैंग्वेज में कह देते हैं कि बॉडीज नेचुरल पेस मेकर, सो विच इज एसए नोड. आप देखोगे कि कितना है, 60 to 100 बीट्स पर मिनट, राइट. सो मतलब उसमें इतना पोटेंशियल है कि वो एसए नोड 60 to 100 झटका निकाल सकता है पर मिनट, राइट. एंड देन एवी नोड कैन डू इट एट 40 to 60. दिस इज वेरी इंटरेस्टिंग, बट ये आगे क्रिटिकल केयर में हम लोग पढ़ाते हैं कि अगर लेट्स जस्ट से एसए नोड काम करना बंद करता है तो देन एवी नोड पिकअप करता है. एट दिस लेवल नहीं. अगर आपको सिर्फ इतना ही पता होगा, एंड दिस इज व्हाट माय जॉब हियर एज अ टीचर इज व्हेन आई टीच माय स्टूडेंट्स एनक्लेक्स, कि उसको कट शॉर्ट करना, कि इतना चाहिए, ये नहीं चाहिए, ये चाहिए, ये नहीं चाहिए. क्योंकि सबसे बड़ी बात व्हेन पीपल फेल एनक्लेक्स इज कि उनको यही नहीं पता चलता, क्योंकि इतने सारे रिसोर्सेज अवेलेबल हैं कि यार कितना पढ़ूं. अब ये जो आप ईसीजी की क्लास में आपको कह रही हूँ ना, 32 आवर्स की क्लास हो सकती है, एंड आई हैव टू टीच यू इन 30 मिनट्स, है ना. तो फिर मुझे वो नैरो डाउन करना है. इसी तरीके से एनक्लेक्स में आपको नैरो डाउन करना है, सब कुछ नहीं पढ़ना है. whatever is important, that's what you guys need to study. So then bundle of his और बंडल ब्रांचेस कुछ नहीं करते. देन पुरकिंजे फाइबर में कैपेबिलिटी है 20 to 40 बीट्स पर मिनट पिकअप करने की. ओके, ऑलराइट. सो नाउ लेट्स जस्ट क्विकली टॉक अबाउट ईसीजी, है ना. स्टूडेंट्स कंफ्यूज हो जाते हैं मेरे पास जब आते हैं पढ़ने के लिए. वो कहते हैं तरन हमें 12 लीड ईसीजी करनी पड़ेगी. सो आंसर इज नो. खुश हो जाओ पहले तो ना, आई वांट टू सी स्माइल ऑन योर फेसेस, एंड कि नहीं यार 12 लीड ईसीजी नहीं करनी. आपको सिंपल अगर पता है इन योर एनक्लेक्स, यू वुड ओनली नीड के 5 लीड ईसीजी कैसे लगानी है. ये बड़ा इंपॉर्टेंट क्वेश्चन है. सो आई एम गोना गिव यू गाइस ऑल द इंपॉर्टेंट क्वेश्चंस एज वेल. सारे तो नहीं, जितने मुझे याद आएंगे ईसीजी में. एंड देन आपको सेकंड क्वेश्चन आता है कि प्लेसमेंट कैसे करनी है ईसीजी लीड्स की. एंड ईसीजी लीड्स को हम कहते हैं इलेक्ट्रोड्स. आई होप एवरीबडी नोज दैट, एंड आई विल शेयर दैट टिप विद यू व्हाट वी टीच टू आवर स्टूडेंट्स. एंड 12 लीड ना कॉम्प्लिकेटेड है. ये आपको तब चाहिए होगा once you guys will become nurses on the floor. फिर जब आपने जाके आगे ACLS स्पेशलाइजेशन करनी है या ICU में काम करना है, तब आपको, अब मैं आपको एक सिंपल भाषा में आपको चीज बताती हूँ, मुझे लगता है वो आपको कॉम्प्लिकेटेड लगेगी. सो दैट्स व्हाई आप सोचो कि क्यों मुश्किल लगता है लोगों को पढ़ना. If you study like 12 lead ECG has lead 1, 2, 3, AVF, AVR, AVL, right? So all those leads are there. They actually read the electrical forces in a horizontal plane. आई मेरी बात समझ में? नहीं आई ना? यही मैं बताने की कोशिश करी हूँ. जब आप किताबों से जैसे पढ़ते हो ना, तो वो नहीं समझ में आता यार ये क्या बोल रहे हैं. And then from lead 1, V1 to V6, you are studying electrical forces from a different angle. अब क्या ये आपको एनक्लेक्स के लिए चाहिए? बिल्कुल नहीं चाहिए. 100% you don't need it for NCLEX. Okay, you just simply need कि हम लोग 5 lead ECG कैसे अटैच करते हैं पेशेंट के लिए. एंड दिस इज व्हाट आई एम गोना डेमोन्स्ट्रेट यू गाइस हियर.
Mandeep is asking,
Yes.
can you tell us difference between 3 to 5 lead and 12 lead ECG, please?
Sure, you know, again, that's gonna be complicated and complicated तो नहीं है, simple ही है, मैं आपको बता सकती हूँ, पर ये है कि we're gonna deviate from agenda, है ना? अब जैसे 12 lead ECG है, मैंने आपको बताया, it's gonna study the electrical forces, Beethoven एक triangle बनता है, and then it is studying the forces from all the different angles, right? But in 5 lead or 3 lead ECG, what we do is we are studying from one plane, एक ही plane और एक ही angle से हम कर रहे हैं. That is the simplest explanation I can give you, and that's the most easy one to read, है ना? तो इसमें देखिए दिस इज द क्वेश्चन विच यू गाइस गेट इन NCLEX अ लॉट, हाउ टू प्लेस, क्योंकि दिस इज व्हाट यू गाइस विल बी डूइंग रेगुलरली. अगर आप मेडिसिन सर्जिकल फ्लोर पे जाके काम करोगे, दिस इज समथिंग विच यू गाइस विल बी डूइंग एवरी सिंगल डे ऑफ योर लाइफ, है ना? कोई पेशेंट टेलीमेट्री पे है, अब मत टेलीमेट्री क्या है ये, यू नो, आई होप यू गाइस नो दैट. अगर नहीं पता तो यू नो दैट्स अ डिटेल्ड क्लास ऑन इट्स ओन. सो देखो, दिस इज हाउ वी टीच. आपको पता है हम सब कनाडा में ऑलमोस्ट रहते हैं, है ना? कनाडा में इट्स स्नो, एंड स्नो किसके ऊपर गिरती है? ग्रास के ऊपर. सो पहले ग्रास फिर ऊपर स्नो, ठीक है? सो दिस इज हाउ यू नीड टू रिमेंबर कि जब हम राइट लीड लगा रहे हैं विच इज ग्रीन, ग्रीन वाली कहाँ आएगी? नीचे आएगी, और व्हाइट वाली ऊपर आएगी, ठीक है? इसी तरीके से देखो, जब आग लगती है, आग हमारी लाल लाल होती है, और जब धुआं उठेगा धुआं काला होगा, ठीक है? सो थिंक अबाउट दिस. सो दिस इज रेड लीड विच इज ऑन द लेफ्ट लोअर साइड, और उसके ऊपर वाली जो लीड लगेगी वो हमेशा क्या लगेगी? ब्लैक वाली लगेगी. और सेंटर में आपको पता है आपने कौन सी लीड लगा लेनी है? ब्राउन लीड. विल यू गाइस रिमेंबर इट? अब आपको ये देखो, ये बात ना आपको अकेले NCLEX में नहीं, आपको नर्स बन के भी ये बात याद रहेगी कि आपने कहां लगानी है. ले लूं टेस्ट? है जी? चलो फिर बताओ कमेंट्स में, वेयर विल यू प्लेस द ग्रीन लीड? ऊपर लगाओगे या नीचे लगाओगे? टेल मी. व्हाट डू यू गाइस थिंक? हाँ जी, आ रहे आंसर टीम? Oh, there is a lag. Okay. I'm just waiting for the answers. I know, you know, this is lag is like really, I'm just trying to understand this. हाँ जी, आगे आंसर्स. आई फील लाइक द आंसर्स आर कमिंग इन. गुड जॉब गाइस, आई एम सो प्राउड ऑफ यू गाइस. अमेजिंग, यू गाइस आर ऑसम. बी गुड नर्सेस, सेव द पेशेंट. जाके किसी की जान बचाओ, यू नो, वो हीरो वाली फीलिंग आएगी आपको, बहुत अच्छा लगेगा. ओके, सो देखो, अब ये बात है ना, अब आप जाके ना अपनी नॉलेज खुद भी टेस्ट कर लेना, राइट? अब 5 दिन बाद भी अगर आप अपने आप को ये सवाल पूछोगे, आपको याद रहेगा. आग लगती है वो लाल है, धुआं उठता है वो काला है. So this means on the left lower, we want to put the right lead. And then, you know, on left upper one, like, you know, you want to put the black lead. So this is how you simply remember your electrodes. Okay? Okay, so now coming to the most awaited topic, which was students were waiting for, cardiac monitoring, right? So before I move on to cardiac monitoring, and just want to talk about the ECG strip जो आप प्रिंट करते हो, उसको हम लोग कहते हैं 6 second strip, अगर आपको किसी को नहीं पता. And then ECG looks something like this, guys. आप देख सकते हो कि उसमें एक बड़ा ब्लॉक है, एंड देन उस बड़े ब्लॉक में छोटे छोटे ब्लॉक्स हैं, ठीक है? सो इसके बारे में हम क्यों पढ़ते हैं इनको? ये हमें टाइम लाइन मॉनिटर करने में हेल्प करते हैं, और टाइम मॉनिटर करने में हेल्प करते हैं ECG की. सो थोड़ी सी नॉलेज सारी नर्सेस को होनी चाहिए कि जो छोटा वाला ब्लॉक है ना गाइस, ये एक बड़ा ब्लॉक है. ये वाला जो ग्रीन वाला ब्लॉक है ना, समझ लो अगर ये ग्रीन वाले ब्लॉक को मैं बड़ा करके दिखा रही हूं इन द माइक्रोस्कोप, दिस इज हाउ इट इज लुकिंग. सो इसमें अब ये छोटे छोटे ब्लॉक्स हैं, ठीक है? तो ये छोटा जो ब्लॉक है ना, ये रिप्रेजेंट करता है गाइस 0.04 सेकेंड्स. ये लिख लो प्लीज अपनी नोटबुक्स में अलोंग विद मी. ओके, सो दिस रिप्रेजेंट्स व्हाट? 0.04 सेकेंड्स. और एक बड़े ब्लॉक में कितने सारे ब्लॉक्स हैं? 1 2 3 4 5. यू हैव 5 ब्लॉक्स. सो दिस मीन्स कि अगर मुझे एक बड़े ब्लॉक का टाइम कैलकुलेट करना है, that's going to be 5 multiplied by 0.04 seconds. ठीक है? So this means एक बड़ा जो ब्लॉक है, that is going to be 0.20 seconds. बस इतना सा आपको ध्यान में रखना है कि जो सबसे छोटा टाइनी ब्लॉक है 0.04 सेकेंड, और जो बड़ा ब्लॉक है वो है 0.20 सेकेंड का. ठीक है? इतनी बात अगर क्लियर है तो we'll move next. Now, लोग इसको देखते ही घबरा जाते हैं. आपने घबराना नहीं है. Don't get scared of it. Let's just understand. And this is what our job at FB and PC is. We make the complicated things simple. अब जैसे आप पढ़ोगे, वो नाम पढ़ते ही घबराहट हो जाती है कि बॉय, ओ माय गॉड, एट्रियल डीपोलराइजेशन, वेंट्रिकुलर डीपोलराइजेशन, वेंट्रिकुलर क्या भाई ये है क्या? लाइक व्हाट इज दिस, राइट? सो आई विल गिव यू गाइस सिंपल वर्ड्स एंड यू गाइस कैन राइट इट विद मी. एट्रियल डीपोलराइजेशन का सिंपल मतलब है एट्रियल कॉन्ट्रैक्शन. ठीक है जी. वेंट्रिकुलर डीपोलराइजेशन का सिंपल मतलब है वेंट्रिकुलर कॉन्ट्रैक्शन. एंड वेंट्रिकुलर रीपोलराइजेशन का मतलब है रिलैक्सेशन. लिख लो आराम से, कोई टेंशन नहीं है, हम कहीं नहीं भाग रहे. इवन इफ आई टेक एक्स्ट्रा टाइम दैट्स ओके, एज लॉन्ग एज यू गाइस आर एंजॉयिंग इट. ठीक है. सो एट्रियल डीपोलराइजेशन को क्या कहते हैं हम लोग? से विद मी, आई नो यू गाइस आर देयर. सो अपने घर में बैठ के अब लोग सोचेंगे कि क्या हो गया, इसको ऊंची ऊंची बोलो. एट्रियल डीपोलराइजेशन इज व्हाट? मतलब एट्रियल कॉन्ट्रैक्शन. Ventricular depolarization means ventricles की contraction, and then ventricular repolarization means ventricles की relaxation. ठीक है, इतनी बात समझ में आई सबको? Now, अब before I move on to this PQRST क्या है, पहले ना मैं आपको थोड़ी सी एक हम ECG को ना थोड़ी रिस्पेक्ट देंगे. ठीक है. दिस इज आई ऑलवेज लाफ विद माई स्टूडेंट्स. कॉमेंट सेक्शन में लिख देना जब आपकी शादी होती है ना, आप इन लॉज में जाते हो. इट्स ओके अगर आपकी मदर इन लॉ भी मेरे साथ देख रही है, दैट्स अमेजिंग, यू नो. तो आप जब आपकी शादी होती जाती है, राइट, तो आप अपनी मदर इन लॉ को मम्मी बोलोगे वो ज्यादा खुश होंगी, या मम्मी जी बोलोगे वो ज्यादा खुश होंगी? क्या कहते हो कॉमेंट्स में? एंड सिमिलरली बताओ, अगर हम पापा कहेंगे या पापा जी कहेंगे, कौन ज्यादा कब खुश होंगे? पुट इट इन अ कमेंट सेक्शन. इतनी देर पे पानी पानी पीती हूँ, तो मुझे बताओ. हाँ जी टीम, comments are coming? नहीं? With the lag again? Okay, so I think कैसे बोलना, मम्मी जी और dear mother, those who are listening to us, you know, in English, you know, father-in-law, dear father, you know, or papa ji, you know, when you say those things. So similarly, you guys need to learn that we have to give respect to ECG. ठीक है? अगर मैं I'm gonna draw the ECG for you guys, and ये भी लिख लो, this is very important for you guys to do it. So P Q R, sorry ये थोड़ा टेढ़ा मेढ़ा ड्रॉ हो गया, बट हियर यू गो, इसको S T. अब P को अकेला P नहीं कहना है आपने गाइस, वी हैव टू गिव रिस्पेक्ट. सो हमेशा ये याद रखना, P इज कॉल्ड एज P वेव. ओके. Q R S को हमेशा आपने याद रखना है कि हम लोग कहते हैं इसको QRS कॉम्प्लेक्स. हम लोग ऐसे ही बोलते हैं इसका नाम, राइट? और अकेला T नहीं है, this is T wave. And again, I'm doing very basics with you guys. I'm not doing too much. So will you guys remember it with me? क्या अकेला P है? No, P is P wave. QRS complexes. QRS नहीं है, QRS complex है. And T is T wave. Okay. Now, if you guys will look at it, PR, so जो distance है ना, जो हमने पढ़ा ना 0.04 सेकंड वाला, जैसे हम डिस्टेंस पढ़ रहे हैं, जैसे आप वो हॉरिजॉन्टल डिस्टेंस गिनते जा रहे हो. सो P से R का जो डिस्टेंस है उसको हम कहते हैं गाइस PR इंटरवल. क्या नाम देते हैं हम उसको? PR इंटरवल. उसके अलावा हमारे पास QRS इंटरवल, आगे यू नो वो सारे इंटरवल भी हैं, बट अगेन आई एम डूइंग वेरी बेसिक्स हियर. एंड देन आप ST को हम लोग यहाँ पे आप याद रख लेना, हम लोग कहते हैं ST सेगमेंट. सो बेसिक सिर्फ इतना याद रखना आपने. सो रिमेंबर, P stands for P wave, Q is called as QRS complex, T is T wave, and ST segment. ठीक है जी, आपने रिस्पेक्ट दे ली, सारे खुश हो गए. ECG is happy now, you're is respecting ECG. Now let's just go back and understand this. So now P wave is representing what? Atrial contraction. QRS is representing ventricular contraction, and T is representing relaxation. So I'm going to stop sharing the screen and now understand with me here. अब देखो, ये atrius and ये है ventricles. Okay, this is how it. So now your atrius will contract. They will push the blood into the ventricles. ठीक है? Now your ventricles will contract and then they will send the blood where? To the pulmonary artery, right side, and then aorta from the left side. So ये mechanism आपका जो है वो चलता जा रहा है. So this means पहले कौन contract करेगा? Atrias, then ventricles. Ventricles are pushing the blood outside. And this is what is exactly reflecting in your ECG. Does that make sense? Yes? Okay, so now अगर आपको इतनी बात समझ में आ गई है, so I can just kind of move on and teach you guys more. So do you guys understand this? Repeating one more time. P wave represents what? Atrial contraction. कि हाँ भाई atrias contract कर गए. QRS means ventricles contract कर गए. QRS का मतलब यही है जब आप देखते हो ECG में. और T है guys relaxation. अब मुझे बताओ एनक्लेक्स की तैयारी करते करते कई बार मेरे स्टूडेंट्स भी कहते हैं यार हम एग्जॉस्ट हो गए. अब देखो जितना एग्जॉस्ट होगा माइंड वो भी खतरनाक है. यू नीड अ ब्रेक. अब हम लोग ये सोचते हैं कि हार्ट चले ही जा रहा है, चले ही जा रहा है, चले ही जा रहा है. नहीं, हार्ट भी ब्रेक लेता है. ये जो आप टी वेव देख रहे हो ना, दैट टी वेव इज अ ब्रेक ऑफ द हार्ट, जहां पे वो हार्ट रिलैक्स करता है. एंड ये जो टी वेव है ना गाइस, दिस इज वेरी वेरी इंपॉर्टेंट. व्हाई? बिकॉज अगर हार्ट रिलैक्स नहीं करेगा ना तो हार्ट फिलअप नहीं करेगा विद ब्लड. आपको ये बात पता है? क्योंकि हार्ट तभी फिलअप करेगा ना जब वो रिलैक्स स्टेट में है, तभी उसमें जो ब्लड फिल होगा, ब्लड नीचे जाएगा, राइट, एंड देन यू विल बी पंपिंग एंड दिस इज हाउ द ब्लड इज गोना कीप गोइंग. मेक सेंस? सो P means atrial contraction, P wave. QRS wave means और शाबाश बताओ मुझे, ventricular contraction. Good job. And then T wave is relaxation. और रिलैक्सेशन बहुत जरूरी है. यू वेव भी आती है पर अब आज हम उसके बारे में बात नहीं करेंगे बिकॉज वी आर नॉट टॉकिंग अबाउट पर्टिकुलर डिजीज कंडीशंस. वी आर ओनली कवरिंग सिंपल ECG विद यू गाइस. ओके, नेक्स्ट इज let's just see, and today I'm going to give you guys guru mantras, and this is guru mantras is tips, and that is going to help make your life super 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 easy. आपने मेरे साथ steps लिखने हैं and इसके बाद हम लोग टेस्टिंग करेंगे. आफ्टर एवरी स्टेप वी हैव टू डू टेस्टिंग कि आपको ECG आ गई है कि नहीं आ गई, राइट? अगली ECG मैं आपसे कराऊंगी. ओके, सो कैसे रीड करते हैं? जब मैं स्टूडेंट थी या मैं जब टीचर बनी, सो पहला स्टेप गाइज हमेशा ये है ECG में, वी हैव टू कैलकुलेट द रेट. ठीक है, अब रेट कैसे कैलकुलेट करना है? बहुत ही सिंपल फंडा है. आप देखो, दिस इज P Q R S T, P Q R S T. सो इस तरह से जैसे आपने लिख लिया अपने ECG में. सो R R R R. सो आपने सिंपल क्या करना है, ये जो आपको स्ट्रिप मिली है, नाउ यू गाइज नो व्हाट डू वी कॉल दिस स्ट्रिप? वी कॉल इट अ 6 सेकंड स्ट्रिप. तो 6 सेकंड स्ट्रिप में गाइज आपने R काउंट कर लेने हैं. सो मेरे साथ काउंट करोगे कितने R's हैं? 1 2 3 4 5 6 and 7. So जितने आपके पास R's होते हैं इन 6 सेकंड स्ट्रिप, आपने जितने भी R's हैं उसको 10 के साथ मल्टीप्लाई कर देना है. ये फॉर्मूला है. तो हमारे पास यहाँ पे कितने R's हैं? 7. So 7 multiplied by 10 means what is patient's heart rate? 70 beats per minute. पहले मुझे बताओ इतना क्लियर हो गया कि नहीं हो गया, right? Okay, somebody saying please use English. Okay, perfect. Thank you. I will use English here. So now what I'm saying is, if you look at the 6 second strip, what you need to do is you need to calculate R's. So in the 6 second strip, how many R's we have? 1, 2, 3, 4, 5, 6, 7. And whatever number of R's you have, you need to multiply by 10. That will give you the heart rate of the patient. So you have 7 R's multiplied by 10 means what's the patient's heart rate? 70 beats per minute. Means patient is like, and you guys know what's a normal heart rate? 60 to 100 beats per minute in adults. I'm only talking about adults in today's class. Second step, and again, guys, these are the steps which are universal. You have to use these steps in every ECG. This will make your life easy. So second step, as a nurse, what we do is we look for rhythm. Rhythm means regular or irregular, right? So now if you guys look at, if you think about the patient's pulse, when you check patient's pulse, for example, you're checking my radial pulse here. So you will see the heart is beating like dug dug. Ab hasna nahi mere upar, okay? Don't laugh at me. Dug dug, dug dug, dug dug, dug dug, right? This is the rhythm, right? S1, S2, S1, S2, right? So this means patient has a regular rhythm, right? Now, let's just see here. How do we see as nurses in the ECG that the patient is having a regular rhythm or not, right? So if you look at this, now you guys will help me. In real world, guys, we use caliper. आपने कभी caliper देखे? Caliper जैसे ना हमारे इंडिया में compass नहीं होती थी, compass. So caliper is like, you know, it's like pointed sharp thingies and you put the caliper to see. But as I'm teaching you guys online, I will change the color of my pen here and you guys see. Now we have to look at the rhythm. That's the second step. Now, in order to check the rhythm, we can calculate. So how many blocks are between R and R? So 1, 2, 3, almost. Can I say this and this block together? So almost 4 blocks gap here. Let's just see the gap between next R and R. 1, 2, 3, 4, almost 4 blocks. What's the gap between next and next? Again, 1, 2, 3, almost 4 blocks. So when you see the gap between R and R and R is almost 4, 4, 4, 4 blocks. What do you guys think? Is it a regular rhythm or irregular? I'm pretty sure you guys are saying it in the class. This is a regular rhythm. Regular rhythm, right? So as a nurse, you figure out, okay, if I look at this ECG, my patient's heart rate is 70 beats per minute and the rhythm is regular. ठीक हो ना? घबराता नहीं गए? जाग रहे हो ना सारे? Okay, perfect. Now, if you look at the third step, guys, third step is you have to see if there is a P wave before every QRS or not. Okay, let's just see. Now, let's just see here. This is P wave before QRS. So, okay, iska matlab we have P wave. Let me change the color of the pen here. Okay. हाँ तो P wave है before QRS? है. Do we have a P wave here before QRS? Yes. Do we have P wave before QRS? Yes. Do we have P wave before QRS? Yes. Do we have P wave before QRS? Yes. 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 So, moral of the story, if you guys have P wave before every QRS, what do we call that rhythm? We call that rhythm as sinus rhythm, right? तो आप उसी rhythm को sinus कहोगे जिसके आगे QRS के आगे P wave होगी. In English, you can only call those rhythms as sinus rhythms when you know the P wave is before QRS. Okay, so this means yes, our heart is working perfectly fine. P wave represents what? Atrial contraction, and QRS is what? Ventricle. So this means your atria is contracted and then you are getting QRS. So this means heart is working perfectly fine. So can you guys name this rhythm? This is normal. Because why we are calling it normal? Because the heartbeat is 70 and you guys know what's a normal heartbeat? Between 60 to 100 beats per minute. So this ECG is normal sinus rhythm. Perfect. Yes. Now, are you guys ready to go and see the rhythm of your family members? Yes, tell them to share with you guys. Okay. Now, will you guys help me with the next rhythm? And I know you guys are very, very smart. And guys, if you're enjoying this session, I have a request to make you guys. Please share this link on your WhatsApp, on your social media, so that your friends can join it as well. ਉਹ ਪੰਜਾਬੀ ਚ ਕਹਿੰਦੇ ਨੇ ਨਾ ਕਰ ਭਲਾ ਹੋ ਭਲਾ. So ਜੇ ਤੁਹਾਨੂੰ ਸਮਝ ਆ ਰਹੀ ਹੈ, if you feel that you guys are understanding it, you know, share it with your friends as well, right? So I'm going to give you guys a little pause. ਮੈਨੂੰ ਪਤਾ ਕਿ some people they don't want to share it ਕਿਉਂਕਿ ਉਹਨਾਂ ਨੂੰ ਲੱਗਦਾ ਸਾਡਾ ਮਿਸ ਨਾ ਹੋ ਜੇ ਸਾਡੀ ਪੜ੍ਹਾਈ. So I'm taking here a pause here little bit and I'm giving you guys 2 minutes to revise it. And, you know, just go through it. Like, you know, okay, what are the 3 steps? In the meantime, please share my lecture link with your friends. And this is, I am so delighted to, you know, you guys have given me so much love. मैं नहीं सोचा कि 200 बंदे मेरा lecture live देखेंगे. Much appreciated. Thank you very, very much. Okay. So if we have 4 or 5 boxes in that normal, 4, 4, 4, to see, Mandeep, don't go by boxes yet. Just follow this pattern which I have told you. Number 1, you just look at the rate. Number 2, you look at the rhythm. And number 3, you look at if this is a sinus rhythm or not. Just follow these 3 steps. Okay. Yes. Ma'am, how blocks between R and R in abnormal rhythm? Yes, it will come. Patience, patience, my friends, patience. Right? And those who are my students, ਉਹਨਾਂ ਨੂੰ ਪਤਾ ਹੈ ਕਿ for patience, I recommend a Punjabi song. You know, Gary Sandhu is my favorite. And Gary Sandhu ਦਾ ਮੈਂ ਗਾਣਾ ਸੁਣਾ ਦਿੰਦੀ ਹੁੰਦੀ ਆ ਕਿ ਹੌਲੀ ਹੌਲੀ ਗਿੱਧੇ ਵਿੱਚ ਨੱਚ ਪਤਲੋ ਹੈ. So remember, ਯਾਦ ਰੱਖਿਓ ਕਿ ਹੌਲੀ ਹੌਲੀ ਕਰੋ, ਹੌਲੀ ਹੌਲੀ, you know, and that's how you're going to remember the things. ठीक है? Share करता, guys, thank you so much for your love, है ना? Please share it out. Let other people also join and let them learn, right? Because ECG, as I said, it scares the people most, right? And we don't want people to get scared. Okay, ready for the next rhythm? Tayar ho? Mere pyare ho? Right? Okay, so let's just do it. Perfect, perfect. Thank you. Okie dokie. Here you guys go. Okay, so now you will help me. Again, don't get scared. I have given you guys a Guru mantra. Start with that Guru mantra first. And number 1 thing, I know you guys are putting it in the chat box. What's the number 1 thing you want to calculate, my friends? You want to calculate rate. And then again, how do you calculate rate? I told you in a 6-second strip, you need to count the number of R's. How many R's are there? So guys, how many we have? 1, 2, 3, 4. And you know the number of R's need to be multiplied by 10. That's a formula. So we have 4 R's in this 6-second strip multiplied by 10. So guys, this means your patient's heartbeat is how much? 40 beats per minute. 40 beats per minute. Make sense? And now, don't jump the guns. You guys know we have to follow the steps. Khush nahi ho jana ki aage ECG, hai? Ruko hale. So 40 beats per minute. And now you guys know the normal heart rate is between 60 to 100. Less than 60 is what we call it as bradycardia. So right away, the nurse looks at the strip and the nurse knows that your patient is in a state of bradycardia. Okay. Now, second thing you guys know, we need to figure out is what, my friends? Rhythm, right? So now we have to figure out, is it a regular rhythm or a irregular rhythm? And again, what do? We calculate the number of blocks in it, right? So now let's just calculate 1, 2, 3, 4, 5, 6, 7. And can I mix this one with this one? Almost 8 blocks, hey? Now let's just calculate 1, 2, 3, 4, 5, 6, 7, and almost 8 blocks here. 1, 2, 3, 4, 5, 6, 7, 8, almost 8 blocks here. So guys, what do we want to call this rhythm as? Regular or irregular? I think this is regular. Hey, some of you are typing it already. Amazing. Good job, guys. I'm really, really proud of you guys, right? Yes, it's a regular rhythm. Third thing, guys, you want to see is, what was the third step? Tell me. We got rate, we got rhythm, and what was the next one? Type it in the chat box. Third thing is we look for if it is sinus or not. And how do we look for if it is sinus or not? You look for P wave. So we see, do we have a P wave here? I know, let's just pretend there is a P wave because, you know, this kind of cut short. So we have a P wave here, P wave here, P wave, P wave. So this means there is a P wave before every QRS. Can you call this rhythm as sinus rhythm? What do you guys say? 100%. Yes, you can call it sinus. And amazing, guys. You guys are giving me wonderful response here. I am loving each one of you. Amazing. Good job. So this means this rhythm, what do you want to name this rhythm? This is sinus. Can you name it sinus? Yes, we can, because there is a P wave before every QRS. So this is sinus bradycardia. Good job. And why are we calling it bradycardia? Because patient's heart rate is below 60. Okay. Thumbs up. Okay. So here is, I'm going to add a little story to it. Okay. Now, Just by knowing that this is sinus brady, sinus tachy, this is good, just for the basics. But when you do NCLEX, you have to do, guys, one more step up. So in your NCLEX, you can get questions associated with interventions. You can get questions associated with assessment. You can get questions associated with clinical manifestations, right? So अकेला ब्रेडिकार्डिया टैकीकार्डिया पता होना enough नहीं है, क्योंकि वो तो कोई रट्टा मार के भी कर लेगा, right? But what's important is to understand the clinical manifestations of it. So now, अब मुझे एक और बात से पता है क्या प्रॉब्लम है, मैं आपको बताती हूँ. कोई भी आता है वो स्टूडेंट्स को कहता है ये याद कर लो, आप ये निमोनिक याद कर लो, आप ये याद कर लो, आप भाई सब कुछ स्टूडेंट को याद करना है, फिर आपने क्या करना है ये मुझे बताओ. सही है कह रही हूँ कि नहीं कह रही है ना? तो अब मुझे बताओ कि साइनस ब्रेडिकार्डिया, चलो आपने किसी ने रट्टा भी मार लिया, पर नाउ अब आप सिम्टम्स भी देखोगे. सिम्टम्स भी हर कोई कहता है याद कर लो, याद कर लो. भाई याद क्यों करने हैं when you can understand it, right? Now think about it. If somebody's heart is beating slow, ठीक है? Imagine. So if somebody's heart is beating slow, do you guys think that patient will have enough cardiac output? Use your common sense. कहीं आपका हार्ट बीट जो है वो 60-70 से ऊपर करना चाहिए, है ना? और कहीं आपका हार्ट धीरे 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 धीरे, it's pumping slow and slow. Do you think patient will have enough cardiac output? No. If patient has not enough cardiac output, imagine the sign and symptoms. Low cardiac output means low tissue perfusion. कैसा फील करेगा पेशेंट? कैन यू गाइस थिंक अबाउट इट? अगर मुझ में ब्लड सप्लाई नहीं है और आप में नहीं है और ये कम है, हाउ विल यू फील? टायर्ड, एग्जॉस्टेड, fatigued, decreased oxygen saturation, right? आप imagine करो. The more imagination you will do, the more stronger nurse you will become on the floor, right? So अगर आप जाओगे, कोई देखोगे पेशेंट जिसकी हार्ट बीट स्लो है, patient is trembling, patient घबरा रहा है, right? Patient is like, becoming paler, yellow in color. Patient is like, it's like anxiety, irritable. What are all those signs and symptoms? Those are the signs and symptoms that patient has decreased cardiac output. Make sense? Now, another common sense question which I want to give you guys. Excellent. Good job, guys. So, rhythm box creating confusion, ma'am. How many normal rhythm boxes we can consider regular? There are no box numbers. बस you have to count के क्या वो बराबर डिस्टेंस पे है. बस आप R का डिस्टेंस देखो. अगर आपको बराबर बराबर लग रहा है कि सेम है, मीन्स वो रेगुलर है. ठीक है? And low cardiac output, low blood pressure, and yes, your patient will present with all those signs and symptoms. अच्छा मुझे बताओ एक क्वेश्चन, इंटेलिजेंट स्टूडेंट्स हो you are all, will you want to give a beta blocker to this patient? What do you guys think? Put it in a chat box, right? No, you don't want to give beta blocker to this patient, right? Because you guys know what does beta blocker, which is LOL family, not LOL on text message कि मैं क्लास लगाई मैंने समझ नहीं आई, LOL, right? Not that LOL. It's LOL family, beta propranolol, beta lol, right? All those LOLs. So the LOL family decreases the heart rate. So do you think the patient, so let's just say if you're working, now this type of question you will get in NCLEX. Let's just say a nurse is working on the floor and the nurse enters the patient's room and she is assessing the patient who is irritable, anxious. Upon checking the patient's heart rate is 40 beats per minute. What do you think the nurse would do for the following prescribed medication? So do you think you want to give beta blocker to this patient? No. What's going to be your answer in NCLEX? You want to hold the medication and you want to notify the physician immediately because patient's heart rate is low. And if you give this patient beta blocker on the top of it, ਤੁਸੀਂ ਪਤਾ patient ਨਾ ਕੀ ਕਰਨਾ, patient ਨੂੰ ਉੱਤੇ ਪਹੁੰਚਾ ਦੇਣਾ ਬਾਬਾ ਜੀ ਦੇ ਘਰੇ, right? Got it? Na? You're going to send patient to God's house. We don't want to do that. As good nurses, we want to save the patient, okay? So you don't want to give beta blocker to this patient. Thumbs up? Thumbs down? Thumbs up. Okay, perfect. All right, great job, guys. Okay. Now, let's just move on to the next one. And again, I would need your help. Now, let's just move on to this ECG. And I just want a little sip of water. Little sip of water. And let's just do this. So, same thing, what we are going to do is step by step. You guys know what's the first step? You want to calculate the rate, my friends, right? And how do you calculate the rate? So in the 6-second strip, you want to count the R's. So let's just say R, R, R. I want to identify all the R's here. And let's just count the number of R's. Abhi Arora. No, Abhi Arora. I have given you guys steps, so that's why I want you to follow the steps. This is not atrial flutter. Okay, patience. So let's just calculate the rate. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. Oh my God. So this means what's my heart rate? Number of R's multiplied by 10. As a nurse, immediately I know that this patient's heart rate is 130 beats per minute. This means this patient is in tachycardia, because you know the heart rate is more than 100 is tachycardia. Okay. Now, second thing, guys, what we look for is we look for rhythm. So the person who was asking me the rhythm, right? So rhythm is basically you are checking, okay, is R and R at kind of the similar gap or they are irregular? So if you guys see here, we are almost 2 blocks, 2 blocks, 2 blocks, right? मतलब gap same लग रहा है आपको, almost same. So बताओ मुझे, is this regular or irregular rhythm? What do you guys think? This is a regular rhythm or irregular? Regular rhythm. Does that make sense? So you have calculated the rate, you have calculated the rhythm, which is regular. And what's the third thing you guys want to see is, you want to see if this is a sinus rhythm or not. For sinus rhythm, guys, what do you guys look for is, you look for P wave. So P wave hai before QRS? Yes. P wave before QRS? P wave, P wave, P wave, P wave, P wave. Yes. So can you see in front of every QRS, we have P wave. Can we call this as a sinus rhythm? Yes, this is a sinus rhythm. But what do you want to call it? You want to call it sinus tachycardia, right? So did you get Mr. Arora, who was saying it's a atrial flutter or fibrillation? No, it is simple case of sinus tachycardia. Okay, got it? Because there is a P wave in front of every QRS, heart rate is more than 100. So the patient is presenting with what? Sinus tachycardia. So now if you guys look at it, sinus tachycardia, sinus now, again, let's just come back, because just by knowing sinus tachycardia is not enough. If you want to be a successful nurse here, you need to know the symptoms. Now, think about it. पहले heart धीरे-धीरे चल रहा था, right? Earlier, heart was going slow, which was bradycardia. Now, up think about it. Heart is going faster, like this, right? And think about it, what I told you guys before. Okay, if the heart is going fast, do you think heart has enough time to relax? No. If the heart does not have enough time to relax, do you think the heart can fill up with the blood? No. If the heart cannot be filled up with the blood, do you think the patient will have enough cardiac output? खुद सोच के देखो, सोचो, बहुत तेज चल रहा है, उसको रिलैक्सेशन का टाइम नहीं मिल रहा, और आपको पता है कि हार्ट कब फिल अप होएगा? जब वो रिलैक्स करेगा. अब जब वो रिलैक्स ही नहीं कर रहा, वो फिल अप ही नहीं हो रहा. जब वो फिल अप ही नहीं हो रहा, तो इसका मतलब हार्ट इज डूइंग व्हाट? एम्प्टी पंपिंग. दैट्स व्हाट वी कॉल इट, एम्प्टी पंपिंग. And then empty pumping means patient is having low cardiac output. If the patient is having low cardiac output, again, look at the symptoms. Pretty much the same, isn't it? Patient would be restless, patient would be anxious, patient would have decreased tissue perfusion, brain में नहीं जाएगा, so patient confused हो जाएगा, altered neurological status, patient can have, all those signs and symptoms. ठीक है? Moral of the story, आपको रट्टा नहीं मारना है. You don't have to memorize anything. जो कोई आपको कहता ना ये रट लो, ये कर लो, बस भाग जाओ वहां से. रट लो नहीं, समझ लो. If you guys will understand things now, even if I'll ask you guys these things after 5 years, you will remember it. But अगर आप रट्टा मारोगे, if you guys will just memorize it, if you will not understand, तो आप 3-4 दिन के बाद ही चीज भूल जाओगे. You guys will forget the things. Does that make sense? So this patient is doing MT pumping. Good job. So these are my students. I think they're replying to me as well. Amazing. Good job, Sabita. I'm so proud of you. And yes, so the patient is presenting with what? Sinus tachycardia. Acha, I'm gonna drink water. Tell me, are you guys enjoying the class? के खत्म कर दूं बस. बताओ मुझे. If you guys are enjoying it, then only I'll teach further. Otherwise, फिर नहीं तो मैं एजेंडा वाले टाइम पे रहती हूँ. बताओ, tell me. ये दिल मांगे मोर और ये दिल मांगे कि बस थक गए यार, बस होने थक गए ਅਸੀਂ. ਦੱਸੋ ਮੈਨੂੰ. Time lag is coming. Okay, yes, I'm just waiting for the messages, taking a little break here. Okay, can continue enjoying. Okay, perfect, good. You know, it's very important to know how the students are feeling because boring class यार केड़ा किताबां पढ़ेगा. Boring किताबां केड़ा मत्था मारदा है. मैं भी हुन गाने गाने शुरू कर दूंगी. Okay, continue, perfect. If you guys are enjoying it, then we'll continue. ये दिल मांगे मोर, perfect. ते दिल मांगे मोर ते शेयर दे करो फिर अपने दोस्तां दे नाल हैं. So there are some people who have joined it and but you know, share it in the groups and with your friends. I know you guys are very smart. You have all the nursing colleges and friends and everybody. Okay. All right. So let's just get to the next rhythm, my friends here. So again, don't get excited. This is what I teach to my students. We still have to follow the steps. Okay. So number one thing, you want to calculate what? You guys know. Rate. Okay, so let's just see. R, 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 R. Okay, so this one you can see we have 1, 2, 3, 4, 5, 6, and 7. So this means, guys, what's the rate? Now you guys, I know you guys are already very smart, but now you guys have become pros. You guys already calculated that rate is 70 beats per minute. Okay, you're feeling energetic. That's amazing. Okay, yeah, Sindhu Varghese, let's just work on this together. Okay, rate is 70. Now let's just look at, that's the next step, guys. We have to look at the rhythm. So what do you guys think? Distance between R and R, same lag raha hai? Is it same? Distance between R and R, distance between R and R, distance between R and R, R and R, R and R, है ना? It looks pretty regular. Hey, what do you guys think about it? So I'm gonna call it as a regular rhythm. Are you guys agreeing with me? Yes, so far? Okay. Okay. Harsuk, I'll take your question after this ECG, okay? Her question is which medication to give sinus tachycardia. We'll talk about it. Okay, rhythm. And then third one, guys, you guys know is whether it's sinus or not. Oh my God. Guys, I hope those who are from India, आपने CID तो बहुत देखा होगा. देखा ना CID? What does they say in CID? कुछ तो गड़बड़ है दया, कुछ तो गड़बड़ है, right? So I'm pretty sure because CID 30 years तक चला यार CID, right? So दया, बताओ मुझे ये साइनस रिदम में कुछ तो गड़बड़ है कि नहीं? वो हाथ भी ऐसे हिला के कौन सीगा वो केड़ा सीगा the name of that CID guy I forgot, right? You guys would remember. ACP Pradyuman, right? दया, बताओ दया, क्या ये साइनस रिदम है? दया, 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 नहीं guys. अब मुझे बताओ, when you guys are here looking at the rhythm, क्या आप आइडेंटिफाई कर सकते हो कि ये ओनली पी वेव है? ये भी पी हो सकती है, ये भी पी वेव हो सकती है, ये भी पी वेव हो सकती है. दिस इज पी. पता ही नहीं चल रहा यार, मुझे तो नहीं पता चल रहा. आपको पता चल रहा है? डज कैन यू गाइज आइडेंटिफाई विच वन इज अ पी वेव? पी वेव, पी वेव, पी वेव. एसीपी प्रद्युमन, यस, पी वेव, पी वेव. कुछ तो गड़बड़ है. रंबा, सही कह रहे हो रंबा, कुछ तो गड़बड़ है, राइट? सो गाइज, कैन वी कॉल इट अ साइनस रिदम? No, because दया, देखो पी वेव पता ही नहीं है कहां पे है, राइट? सो दैट्स व्हाई वी कैन नॉट, दिस इज नॉट अ नॉर्मल रिदम. तो वहां पे आपको दिमाग की घंटी, मेंटोस खाओ, दिमाग की बत्ती जलाओ, देन यू वुड नो कि नहीं नहीं है, ये साइनस रिदम नहीं है भाई, कह ही नहीं सकते. इसका मतलब कौन गड़बड़ कर रहा है? गड़बड़ कर रहे हैं हमारे एट्रियास. So because we cannot identify the P wave. So this means this is some kind of problem with the atria. So ye matlab this is some kind of atrial rhythm. Got it? Now just look at it. So do you see a pattern here? And we call this pattern as a sawtooth appearance. ठीक है? Sawtooth appearance, जैसे एक सिंपल एग्जांपल है, इन हिंदी आई गिव इट टू द स्टूडेंट्स. आपने कभी वो लक्कड़ काटने वाली आरी देखी है? अगर आप आरी को देखो, you know, this is how, and people in English, you know, this is the saw, you know, with which you cut the wood. So if you see this pattern, we call this pattern as a sawtooth appearance, right? If you see this sawtooth appearance, what do we call it? This is atrial flutter or fibrillation. This is flutter. Always remember. Okay? Okay, sawtooth means patient is having what? Patient is having atrial flutter. I'm going to change the color of pen and talk a little bit more about it. So now this means, ये जो हमने फिर students कहते हैं कि तरन, what is this rate 70? This 70 is now ventricular rate. क्योंकि RRR, QRS represents ventricles, right? And now if we have to calculate atrial rate, अब आपको नहीं पता, ये भी P हो सकती है, ये भी P हो सकती है, so I don't know. So I'm going to calculate 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22. So this means ventricle rate to 70 hai, but my atrial rate is anywhere 22 multiplied by 10, which is 220 beats per minute. Oh boy. So this means your patient's ventricle rate is 70, but atrial rate is around 220. So students, they asked me the question in this classroom, they would say, Taran, why patients with atrial flutter or fibrillation can have a normal life? Well, guys, because you guys know these patients, primarily, I'm not saying atrias and ventricles are important. Both are important to us, but ventricles play a major role because, you know, ventricle has to pump and push the blood to the whole body, whereas atrias are pushing that blood into the ventricle. So jab tak ventricles अच्छे से काम करेंगे, you know, patient can still have a normal life. However, when you hear or feel the pulse of these patients, when you guys will go into the clinicals, जब आप pulse feel करोगे ना guys, flutter में और fibrillation में, आपको ऐसा लगेगा जैसे घोड़ा दौड़ रहा है, दुक 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 non-stop. So earlier, remember, in normal sinus rhythm, when you will feel the pulse, it would be like duck 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 duck, you know, S1, S2, S1, S2. But in this one, it's gonna be just like जैसे घोड़ा नहीं रेस दौड़ता, like non-stop. You will not be able to count. आप जैसे ही हाथ रखोगे ना, और मेरे स्टूडेंट्स बड़े हैरान होते हैं when I used to take my students to the clinical, तो जब वो ऐसे ना हाथ रखेंगे ना, वो घबरा जाते थे, जैसे तरह पता ही नहीं चल रहा क्या हो रहा है, right? So मैं कहती थी डरो मत, think about it, what's happening. So most of the time, those are the patients who have atrial flutter or atrial fibrillation, right? So अब flutter और fibrillation बहुत close है. क्या फर्क है मैं आपको quickly आप, you know, now if you guys have understood flutter, you guys will be easily understanding. Somebody is asking regularly, हाँ अभी अरोड़ा, calm down your horses, regularly, irregular, इतनी दूर मत भागो, okay? Hauly, धीरे धीरे, you know, we'll work on this. वो आ जाते हैं different, वो that's a different kind of rhythms. Okay. My 9-year-old son wants to take class from you, Taran. He looks very interesting teaching. Oh my gosh, thank you so much. So now this lecture is going to be on the YouTube. Sorry, make sure you guys, you know, share it with your friends, okay? Those who have missed it, I know some people are on work and stuff like that. Okay, so now use a common sense. What type of question you can get it in NCLEX? So now with flutter and fibrillation, guys, they ask you the question, what do you think? Which type of drug this patient should be on? Those who are my students, chalo bhai tumhari aaj knowledge test hoegi, my dear friends and my lovely students. What type of drug this patient should be on? So this is the type of question you get it in NCLEX. Oh, Abhi, you're saying you're asking me. Nahi, Abhi, these are not regularly irregular. No. So I told you those are different complicated dysrhythmias, and we are not talking about those today. Okay. Next is, yes. So now, what type of drug this patient can be on? I told you, think about it. This is a commonly question which is tested in NCLEX, right? So now think about it. Now what's happening is, now when the atrias are doing flutter or fibrillation, uska matlab ye hai, atrias are, so ventricles are doing normal pumping like this, but your atrias are doing something like this. Okay? We call it at different names. We can call it quiver, we can call it flutter. अब क्या हो रहा है कि atrias एक nice push नहीं दे रहे हैं. They're not giving a nice push, but they are doing this kind of flutter. So when it flutters, what happens is the blood in the atria is not getting pumped. And you guys know when the blood is not properly getting pumped, it can get stuck at one spot. और वो एक जगह पे रह के क्या बना सकता है? Blood clot. So patients who have atrial flutter and atrial fibrillation, they are prone to develop blood clots. So this patient should be on blood thinners, right? And again, that's a very detailed part, you know, aspirin dena hai, kaun sa dena hai, which cascade to work on. Again, those are very like elaborated classes, you know, that's what we do in our whole program. That's why now you guys can see, we try to make things very simple. वो जो पूरी 4 साल की nursing है, we have to squeeze it into 3 months. That's what we teach to our students. Yes, good job, Maninder Singh. These patients should be on anticoagulants, right? And again, फिर वो anticoagulants की भी grading है, guys. Which one we want to start? Level 1, then level 2, then level 3, right? But again, I don't want to cover those today because I'm just doing basic rhythms. I hope you guys are okay with this. Yes? So flutter yaad aa gaya? Cool? Okay, now let's just look into the next one. No, nomad nurse, we won't go into heparin. Okay, so nomad, don't do your question wrong in the exam. So heparin pe nahi jayega ye patient. This patient is going to be on different blood thinners. Okay, no Jyoti, no heparin for this patient, right? Okay, now let's just do this one. Abhi Arora, I hope you are still here. Now look at this one now. This is going to be the interesting rhythm for you. Now let's just start with step number 1. Let's just calculate the rate. Again, you guys will see, this is R, 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 R. We are calculating it here. So here you can see we have 1, 2, 3, 4, 5, 6, 7, 8, 9, right? So this means 9 multiplied by 10, your heart rate is 90 beats per minute. Okay. And let's just calculate the rhythm. Okay. So now if you guys look at the rhythm, now see here. In first R and R, you have 1, 2, 3, 4, almost 5 blocks gap. In this one, almost 3. Now the gap is only left 2. Now again, the gap is increasing. So this means, what do you want to, does it look like a regular rhythm to you guys? No, doesn't look regular to me. Look, it's irregular, right? It's 5, 3, 2, 2, 3, 5. Like, you know, it's a different. R के बीच में distance देखो, कभी बढ़ रहा है, कभी कम हो रहा है, कभी बढ़ रहा है, कभी कम हो रहा है, right? So I want to call this rhythm as a irregular rhythm. Okay. Third one you guys want to see is whether it's a sinus or not. So now you guys see, can you guys see if this is sinus? Can you distinguish P wave? क्या आप बता सकते हो कि P wave कहाँ है? No, you cannot distinguish the P wave क्योंकि देखो, it looks like अब मुझे पता ही नहीं, I don't know which one is the P wave here, right? So this means if I have to calculate precisely, so if अगर मैं calculate करूँ ना, so this, so ये जो rates हैं, P wave, if I have to count, the rate is gonna be more than 300. So now do you guys the difference between, now you guys know, is this a sinus rhythm? No, this is not a sinus rhythm. So this means, again, problem is where? Problem is in the atrias. So this is also some kind of rhythm, atrial rhythm. And you can see in flutter, you had a special pattern, which we call as sawtooth appearance. And in this one, because ये zigzag line है, zigzaggy, 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 this is a case of atrial fibrillation. Does that make sense? And now students, they ask me, Taran, what's the difference between fibrillation versus flutter? And flutter, now I'm just going to go back here. See, जो हमने rate calculate किया था, atrial rate was around 220. In fibrillation, rate will be more than 300. So this means your patient's ventricles are still doing okay. Ventricles are beating at 90 beats per minute, but your atrias are quivering. They are like, again, at like 300, right? So this is the case of what? Atrial fibrillation, right? And then same thing, your patient should be on which medication? Blood thinners. And again, we have different levels. And again, we covered all those levels in our classrooms, right? I have limited time, so I could kind of keep going. So is this clear? Yes, so far? Okay, cool. And now coming to, this is the second last rhythm. And I don't want to go too much in depth because I think we're almost running out of time. And here you guys can see, we cannot see P, we cannot see QRS, we cannot see T. And you know, they are looking like line like this, right? And you know, what do we call it? This pattern? Tombstone. Do you guys know what tombstone? जब कोई मर जाता है, उसकी कब्र के ऊपर पत्थर लगाते हैं ना, उसको हम कहते हैं tombstone, right? So this is tombstone pattern. So whenever you see tombstone, this means the patient is in ventricular tachycardia, right? And guys, you know, until atrial fibrillation, atrial flutter, patient was having a normal, still patient could lead a normal life with some drugs and medications. But when your patient goes into VTAC, that's the time it's a problem, because now who's under the problem? Ventricles. And you guys know ventricles are the one which are going to supply blood to the whole body. So जब ventricles involve हो जाए ना, तो then you guys know कि दया अब मामला सच में गड़बड़ है. This is really going to be a trouble. Okay, does that make sense? So in VTAC, you know, you want to give the medications, and I'm going to give that quiz to you guys because you guys have been responding so well. And I'm so happy nobody left the class. सारे ਇੱਥੇ ही है भाई, मजा आ गया. Thank you so much यार, इतना प्यार ਮੈਨੂੰ ਤੁਸੀਂ ਪਹਿਲੇ live ਦੇ ਵਿੱਚ ਦਿੱਤਾ. I am super blessed. So now, can you guys name a drug? Smart people. ਹੁਣ ਮੈਂ ਪਾਣੀ ਪੀ ਲੈਣੀ ਹੈ ਥੋੜਾ ਜਿਹਾ, ਇੰਨਾ ਥੋੜਾ lag cover ਹੋ ਜਾਏਗਾ. Which drug do you want to give in VTAC? ਦੱਸੋ ਕੋਈ suggestion ਦਿਓ. Guys, tell me. Any drug which you guys can think of. Sabita, Amiodarone. Yeah, in India, ਆਪਾਂ ਨੂੰ ਕਹਿੰਦੇ ਸੀ Amiodarone, ਹੈ ਨਾ? ਇੱਥੇ in Canada, it's pronounced as Amiodarone. Yeah. Shock. Oh, Abhi Arora. Siddha shock. Huh? No. Okay, listen, everything has steps in the life, right? So you want to see. Okay. Cardodron 150 milligrams bolus. Atropine. कौन है भाई जो atropine दे रहा है? Hello. What is atropine going to do? Atropine, boom. Epinephrine. Oi. Next level. Amiodarone, adenosine, Bhumika Patel. Yeah. Please take class on YouTube bi-weekly. मेरे न्याणे रुस जाणगे. उन्होंने कहना तरन तू ते जाके उत्थे चली गई live ते सानू कौन पढ़ाएगा, right? So I will try my level best. You guys tell us the topics. And yes, Nugifilak is saying calcium channel blocker if pulse present. Cardio version with Amiodarone. Soha Patel, good job. Soha is my student as well. Soha, I'm really proud of you. Okay, guys. So yes, drugs like Amiodarone can be used. But again, this is very extensive. I have a limited time. I cannot teach you guys everything here. And if you're enjoying so far, you know, you're more than welcome to come to our classes. You know, I'll be very happy to explain you guys everything in detail, how it works. But yes, drugs like Amiodarone can be given to this patient. Okay, let's just quickly moving on to the last one. Okay, now you would see this was VTAC, ventricular tachycardia. Now next is this one. Can you see this wavy zigzag line? Right, so now earlier, if you look at the VTAC, there was still a pattern. Can you see that? Ek pattern to tha, jo chal raha tha. Like there was still a pattern going on. But now, if you guys look at this line, guys, if you're working in ICU, if you're working in your emergency departments, if you're working in med surg, if you see this, what does that tell you? That it is time to probably defibrillate your patient, right? So now this one is called as VFib or ventricular fibrillation. And now I will help you guys, like, like little brief is good, but let's just say when I teach intensive care unit nurses, or if I'm teaching intensive programs or specialization students, ventricular fibrillation is of different kinds. Okay, just to let you guys know, ventricular fibrillation can be monomorphic, and ventricular fibrillation can be torsady depointy, right? So those are the different kind of fibrillations which are there. And then we have different type of treatment what you can give it. But does that you need for NCLEX? इतना ज़्यादा पढ़ने की ज़रूरत है? नहीं. So in NCLEX, if you guys just know this much, that if this patient is on ventricular fibrillation, means probably this patient needs shock. Okay. And in shock, students, they always get confused. And I'm going to leave this question to you guys. अब मैं सारा कुछ एक ही क्लास में थोड़ी बता दूंगी, हैं? So students, they always get confused between two things, cardioversion and defibrillation. Okay. So, but ventricular fibrillation rhythms, you guys are smart. Think for yourself, because I always leave my students with the question, क्योंकि जब तक सोचोगे नहीं, right, तो दिमाग कैसे चलेगा दया? You have to think, right? ਹੁਣ ਸਾਰੇ ਸਮੋਸੇ ਜੇ ਟੀਚਰ ਨਹੀਂ ਖਵਾਤੇ ਤੇ ਤੁਸੀਂ ਆਪ ਹੀ ਤੇ ਸਿੱਖੋ ਨਾ ਮਾੜੇ ਮੋਟੇ ਸਮੋਸੇ ਕਿੱਦਾਂ ਬਣਾਉਣੇ ਆ. So we will be giving this patient shock, and you guys know more than shock, we might have to do CPR on this patient, depending, if they're in monomorphic or they are pulseless or they have pulse, or, depending upon that situation. So that is VFib, very, very dangerous. Probably you would need CPR, defibrillation in that patient. That's my references. Dhanyavad, right? And this is for our students, we give them booklets to test their knowledge. And so now let's just, if you guys have any question, you can ask me. And otherwise we can talk in general. Padhai khatam, gallan shuru, right? Because my students know I just not only love to teach, but then I really want to connect with the students. It's very important to understand what you guys want, how can we help you? Because at FPNPC, we are a big organization. We just don't say it. We really are a big organization. We have more than 10 admin staff, which is admin support to support our students. So if you guys look at, the ratio, because, this is another misconception people, they say is that FPNPC has lots of students, so they don't give personal attention. No, guys, we give personal attention to every single student we can. We have like lots of staff, and we have lots of faculty who work, but primarily I'm the one who teaches the class. I teach the whole classroom. I teach the whole program. I teach full NCLEX and full RPN program. And this is our team. And this is our founder, Mr. Harry Sagar. Harry Sagar sir has amazing journey on his own. I would request him someday to come and talk to you guys. He was physician, he was doctor back home, and now he did nursing here in Canada. And that's how this business was originated, that, we want to help nurses. And I want to give you guys a little overview कि ये business कैसे शुरू हुआ, क्योंकि students को लोगों को पता ही नहीं है कि FPNPC के बारे में कई बारी, कि कहीं से इधर उधर से सुनी सुनाई बात है, तो मैं आपको खुद आके आज बताना चाहती हूँ कि FPNPC क्या है. So guys, मैं तो I was doing very well, है ना? I was teaching at University of Regina, Saskatchewan Polytechnic, बहुत अच्छा जा रहा था, and Harry sir was physician back home, तो उन्होंने यहाँ पे आके nursing pursue की, क्योंकि उन्होंने nursing में जाना था, and फिर क्या हुआ कि when we started meeting people, our nurses, they were working in Tim Hortons, McDonald's, restaurants पे हमारे nurses जो हैं वो काम कर रहे थे. And then हमें बड़ा मतलब दुख होता था कि कि उनको देख के कि what's happening, कि आपने अपनी इतनी एजुकेशन कैसे वेस्ट की है, क्यों आप कि क्यों नहीं आप पढ़ रहे हो, या क्यों नहीं आप नर्सिंग में आते हैं ना, कि you have spent so much of time. And then we figured out कि this problem ये अकेली मेरी और तुम्हारी problem नहीं है, ये problem बहुत बड़ी है. There are so many people who are not working, and I feel your pain, because as an international student, जब मैंने transition किया, when I transferred, I moved from Ontario to Saskatchewan. This is my little story. and and my license was transferring from Ontario to Saskatchewan. उस time Saskatchewan में ये है कि when you guys work with Saskatchewan Registered Nurses Association, they check your background check from the employer before. And I thought कि PJ, the hospital where I come from, is so busy कि किसी ने मेरे documents भर के भेजने ही नहीं है. Nobody is gonna send my documents to SRNA. So then I moved because of PR from Ontario to Saskatchewan, and my license was not there. So I have worked gas stations. I have worked on McDonald's. I have done drive-through. I know how it feels. I have cleaned tables. I have picked up garbages. Don't get me wrong. I'm not saying that those jobs are wrong or bad, but जब हमने इतनी पढ़ाई की है, now think about it, you know, when we can save someone's life, why do we have to waste it up in cleaning up the tables in a restaurant? And that's how, guys, this business was started, just with one student. And with all your love and affection, you know, this business has not, I don't like to call it as business. This organization has grown so far, which is genuinely supporting internationally educated nurses since 2016. We have knowledge, we have skills, and we also have a vision. We also know कि ये कहाँ तक जाएगा और हमने कैसे अपनी nurses को help करनी है, support करनी है. We are very, very visionary team. There are lots of people. We are very curious, like कि क्या नया करें, क्या नया initiative लाएं. कुछ copy करके नहीं, कुछ नया, right? So मतलब copy तो कोई भी कर लेगा. We have to be inventors. So I'm very proudly say that FBNPC is the leader of this industry, which has been supporting internationally educated nurses. हम लोग पहले YouTube पे या सोशल मीडिया पे कम आते थे क्योंकि हमारा पूरा जोर काम करने में ही लगा हुआ था. पर अब हमें ये एहसास हो रहा है कि आजकल दुनिया सोशल मीडिया की हो गई है. तो जब तक आप सोशल मीडिया पे नहीं जाते तो लोगों को आपके बारे में पता नहीं चलता, या फिर अगर पता चलता भी है तो वो हेजिटेट करते हैं. सो दैट्स व्हाई यू गाइस कम हियर, and you know, we want to support you guys. We want you guys to know about FPNPC. We want you to know how we all struggled. दिन and रात हमने मेहनत की है to be here. Hours and hours and hours we have spent. And मैं आपको बता नहीं सकती कि how much we have efforts and works we have put it in. आज पिछले साल more than 1,000 I think 4,000 or 5,000 से ज्यादा CNO में रजिस्टर हुई हैं. 1100 से ज्यादा हमारे स्टूडेंट्स थे, राइट? सो दिस इज हाउ प्राउड वी आर. अब देखो ना, अगर हम खुद काम करते, अब इतनी नॉलेज के साथ मैं सिर्फ 2 हाथों के साथ काम कर सकती थी इन कैनेडियन हेल्थ केयर सिस्टम और अमेरिकन और ऑस्ट्रेलियन. नाउ वी आर ट्रेनिंग हंड्रेड्स ऑफ आवर स्टूडेंट्स who are going, and they are blessing for the patients, they are blessing for the healthcare system, because they are very knowledgeable. They are going with the in-depth knowledge. उनको पता है कि क्या करना है. They are cracking the interviews, they are getting the jobs. Okay. So Baki guys, if you guys have any question, you know, come talk to us. Ramba, pacemaker, lidocaine. Yes, Sindhu, we can give the lidocaine as well to the patients. मैं थोड़े questions देख रही हूँ अब chat box में. Ramba, yes. You know, so this is, as I said, this is not a business for us. This is our baby, you know, and we have, like, every day students are sending us messages, Taran, with the, you know, with this nursing job, we have bought a house. हमने कभी सोचा ही नहीं था कि हम कभी घर लेंगे. We have bought a house, we have got a car, we are giving nice, you know, life to our kids. So, and again, we give the information here, which is fruitful for everybody. Right? ऐसा नहीं है कि, you know, कि, for example, I'm just going to give you guys a simple example. For Ontario, application process has changed. Like, no, अब आपको NNS की जरूरत ही नहीं है. You can do your simple application from Alberta and then transfer the license. But नहीं हो रहा. लोगों को अभी भी यही advice मिल रही है Ontario से कि you have to do CNO, you have to do USA application. क्यों? क्योंकि 2 application करनी है, right? उन लोगों ने. पर ऐसा नहीं है. At FPNPC, we genuinely work with, you know, what students का benefit जिसमें होगा. This is what we work. And you know, सारी टेंशन भुल गई. एग्जाम दी लाइव आके. यस, जसप्रीत, टेंशन नहीं लेनी, पास हो जाना तुसी, मैनू पता. And this is what I want to say. Please spread the word. We cannot do it without you guys. You guys have given us lots and lots of you know, support to us, and we have been growing every single day. It's just कि like when people they get stuck and उनको गलत guidance मिल जाती है, उनको पता नहीं चलता, and or misinformation है, misguidance है, जो भी है. I don't want to call anything, you know, but please just spread the name out for us. And if you guys enjoyed today's lecture, share with us. Next week, what do you guys want to study next week? tell us the topics. What do you guys think? Yes, guys, if you, yes, sure. Join us. Chalo, theek hai. This is what I'm gonna do. This is the first live. You guys have given us so much love. Okay, I'm gonna announce. If you guys even wanna join our December batch, which is starting from December 5th, we'll give you $300 off. Come. Jo humne band kar diya tha discount, we'll give it to you guys. Aa jao. Right, you know, and this is why we want to help each one of you. Okay, we want to help you, and you guys have supported us so much. Okay. Any other questions in your mind? And next is clinical skills, guys. So stay tuned. I have a big announcement and information coming for you guys. You guys are here. Clinical skill videos are coming. Yes. So that's why you guys need to subscribe to our channel and share our channel with your friends, because we will be announcing prizes as well. And the more you guys will share, the more chances you have, and comment under our videos to win the prizes. Because lots of our nurses were struggling with the clinical skills. उनको पता नहीं है कि यार चलो NCLEX तो हमने पास कर लिया, जैसे मर्जी किया, with the knowledge किया, with the रट्टा किया, जो भी किया, but then we don't know how to work. Confidence नहीं है, क्या करें? Patient की blood sugar कैसे लेनी है? How to do the blood sugar monitoring? We don't even know that. So we have all the clinical skill videos coming for you guys. This is the special announcement I wanted to make on live, and stay tuned. बड़ी जल्दी धमाका होने वाला है, and tell me, you know, and then come over and subscribe to our channel so that you guys get the first notification of that. Yes, and thank you for all your love, and that's what we are going to do, and to support each one of you guys so that you guys become successful in this career. I hope you guys enjoyed today's class, and as I said, don't forget to subscribe and share our channel. Any other questions for me before I head out? Love you guys too. Love you. Thank you, Ars. We'll be very happy to help you. And let me just see, scroll down. What is the class time according to India time for NCLEX? It's going to be early in the morning. However, we do provide recorded lectures. So nahi tode to uthya gaya, and recorded lectures are going to be exactly like how I taught. And so you guys can, you know, do that. Chani Singh is saying amazing. Thank you very much. And the class timing will be 4 a.m. And can't see overall class, Harpreet. Thank you so much. And I appreciate it. And next time, what do you guys want to study? Put the topic here. Love you guys. Love you. Love you, Chani Singh, Bhumika, I, Gurinder, Ramba, Devi. Dose calculation? Theek hai. So Devi, that's the deal. So next time when I come here, my subscriber should be, मैं छोटे-छोटे goal देती हूँ, more than 8,000. And help me with the 8,000 subscribers this week. Abhi 7.56 pe hai. And I promise, if you guys will share my channel, next Saturday, same time, I will come and I'll do 2 formulas with you guys for dosage calculation. Okay? That's my promise. And this is the best part of FP and PC is, yes, Nomad Nurse, you want ABG analysis? Sure. Share our channel, same time. Oh, na Punjabi da gana mainu yaad aa gaya, sunada tanu. Same time, same jagah. Phir mar janiya ke chhat te mili hai. So this is the Punjabi song which I love the most. So we'll come same time, Saturday. Je tanu ye time suit karda, Saturday, and we'll come at 10 a.m. Saskatchewan time, and I'll teach you guys dosage calculation, 2 formulas. But you guys have to help me go spread the channel. Okay? And we'll see you there. छोले भटूरे भी खवा दोगे? हाँ, 8K सब्सक्राइबर पक्का. जेड़ा 8K सब्सक्राइबर करा देगा तो छोले भटूरे. 10K ते ना फिर तो मैं अगली बारी दसूंगी कि केड़ा प्राइस दूंगी. आज ही नहीं सारा कुछ कह देना पा. We'll keep on doing special prizes. 10K special prize, 15K special prize. So ठीक है, आ जाओ फिर. Okay, guys, thank you so much for your love and support. I hope you guys enjoyed. We'll leave this whole class on for the students, and mental health also. Sure. Let's just do, and I'll tell you, I'll make a poster and I'll share it with you guys. Perfect time, Simran? Chalo ji, theek hai. Okay ji. Tata, Sat Shri Akal. Thank you very much for all of you guys. Shabba khair. Thank you to see aaye sare time katke, and those English speakers. Thank you so much for coming to our class. Much appreciated. And please share our channel with your family and friends. 8K subscribers, next class on Saturday. 8K to na hoye, phir main chutti maar lani hai. Okay? then I will take a leave. Okay. So